Hi, I'm Whitney Barrett, and I'd like to welcome you to our course, Become an EMT. Our team here at the Denver Paramedic Division is excited you are interested in advancing your healthcare knowledge. Whether your goals are to go on to become an EMT, or you're looking to gain fundamental knowledge about emergent patient care, stabilization, and disease processes, this is a great course for you. During your time with us, you will learn the fundamentals of taking care of stable and unstable patients before they get to a hospital. You will learn about how to identify time-sensitive diseases, and you will learn about all sorts of medical and traumatic conditions that affect both adult and pediatric patients. Healthcare is an exciting and ever-growing profession that can take you many different directions, and the fundamentals you will learn here provide an excellent foundation for anything you might go on to do. We'd like to give you an overview of what to expect in the coming courses and introduce you to our other instructors. In the first course, EMT Foundations, you will learn about the history of emergency medical services as an industry, and you will learn the personal requirements to be an EMT. We will spend some time defining some of the laws and principles that determine the way care is delivered in the United States, and you will learn some medical terminology and basic anatomy so we have a shared language to talk about topics moving forward. You will also get your introduction to principles of patient care. First and foremost, you will learn how to keep yourself and your patients safe by assessing your scene and preparing yourself to provide care. From there, you will learn the basic framework for patient assessment that is used by pre-hospital providers and will be used for the rest of the specialization. There's some really important core information in EMT Foundations. Here's the rest of the Denver Health Coursera team to tell you about the other courses.
Thanks, Whitney. I'm Angie Wright, and I'll introduce you to courses 2 and 3. Let's talk about Course 2, Medical Emergencies, Airway, Breathing, and Circulation. You might have caught on here, but we will be covering the ABCs. In caring for people before they get to a hospital, you can't overlook airway, breathing, and circulation. If you haven't addressed those, you will have missed an important and sometimes life-saving intervention. In this course, you will learn how to manage an airway with basic skills and equipment, how to assess breathing problems and what causes breathing problems, and you will get very familiar with how the blood is circulated in your body. It's not about all ABCs in this course, though. You will also learn about medications and medication administration that EMTs are allowed to provide, as well as how to identify a patient having a stroke or a diabetic emergency. It's okay if you aren't sure what all that means right now. Just be excited about life-saving skills and the information that you're going to learn. In Course 3, Medical Emergencies, CPR, Toxicology, and Wilderness, you will build on the knowledge you obtained in Course 2 to evaluate and take care of a variety of patients in need. You will kick off the course by learning the fundamentals of high-performance CPR, or cardiopulmonary resuscitation. This is where your EMT skills really do save lives. Additionally, you will take your patient assessment skills to new types of patients and new patient locations. Learn to assess and care for patients who are under the influence of drugs, alcohol, or other substances, and might also have an additional medical complaint. Finally, take your skills on the road as we cover the care for patients who might be injured in the wilderness or be suffering from problems related to being outdoors, like altitude, illness, or temperature-related problems. Now here's Art to wrap up the overview of your coursework.
Hi, I'm Arthur or Art Pliakonis. In Course 4, Trauma Emergencies, you will learn how important pre-hospital care can be for the acutely injured patient. Severe trauma is time sensitive, and in this course, you will learn the keys to performing a rapid trauma assessment, providing stabilizing interventions, and using that information to determine transportation priority. Additionally, you will go in depth into the different types of injuries patients can sustain, clues to the severity of their injuries, and findings that will require your immediate attention. In Course 5, Medical Emergencies, Pregnancy, Infants, and Pediatrics, you will spend time learning about some of our most vulnerable patient populations: pregnant patients, infants, and children. Care of the pregnant patient can be challenging and intimidating. Not to worry, you will walk away from this course with a better understanding of the pregnant patient and how you can provide the best care for them. Additionally, you will learn the basics of assessing kids, as well as learn how to take care of a child that is sick, injured, or even in cardiac arrest. You will wrap up the course with some final lessons before we let you loose on your final project.
That's right, Art. Course 6 will be your opportunity to put all your learning together as you work through multiple patient scenarios that will challenge you to apply the things you've learned to real patient situations. It will also introduce you to the model that is taught by National Registry for Testing. Before we close out here, there's a final team member to meet.
I'm Kat Lopez, and before you launch into the course, you should also know that throughout the course, you should keep an eye out for the skills videos. Some of the skills you will be responsible for as an EMT are really difficult to learn without being able to put your hands on the equipment. Our hope is that with the help of these videos, you'll be able to think through how you would perform these skills and the steps involved so that you are much ahead when you get the opportunity to actually do the skills in the skills portion of the course.
With that, good luck. You will see a lot of us over the next weeks, and we're excited to share this learning adventure with you.